COVID-19 infection numbers suggest the country may have reached the peak of the fifth wave of infections. This is despite government not officially recognizing the start of a fifth wave to begin with. The 7-day test positivity average data shows a slight decrease in infections. Ridhwaan Suliman, CSIR Senior Researcher, joins us now to help us make sense of all of those numbers. So Ridhwaan, good evening. Thank you for joining me. I was just looking on the raw numbers. The number for yesterday was around 1,600, and I can't remember the number of tests conducted in the 24-hour to 48-hour period preceding yesterday. But I'm seeing now that the numbers we are reporting are at about 4,227 new cases identified from about 27,000 thereabout tests conducted in the preceding 24 to 48 hours. What's the trend here? Is it accurate to say we are seeing the ebbing off from the unofficial fifth wave?
Good evening to Lasizwe. Yes, indeed, we are well past the peak of the fifth wave of COVID-19 infections in South Africa. The numbers that you just quoted are based on the weekend testing numbers. So we know that on Mondays and Tuesdays, the number of reported cases are always relatively lower than what we see for the rest of the week. So it's important to look at that 7-day rolling average of case numbers. At the moment in South Africa, that 7-day average is just over 5,100 new cases per day. That figure has come down 25% compared to a week ago. And promisingly, it's down from a peak that we had reached just over a week ago and down to about 2/3 of that peak value. So certainly we can indeed confirm that the number of infections are on a decline. Furthermore, that test positivity is also declining. As you indicated, the number of tests conducted also reduces over weekends. But that 7-day average of test positivity nationally is down to 19% currently. And that figure has come down from just close to 24% a week ago. So all indications that we are certainly well past the peak of this fifth wave.
Yeah. In fact, as we talk, I'd like the team to bring up that slide, because you do share detailed slides that show the numbers you're talking about. The one that talks about the 7-day average infections in South Africa. And we pick up from there as we look at that slide. But what does it tell us about other provinces that continue to be of concern? There's the average daily COVID-19 cases per week, and it tracks it all the way back to May last year, and there are the graphics that you are showing us. What story do we extrapolate from those numbers there?
So if you look towards the right-hand side of the graph, you'll see that we've been in the fifth wave for about 5 weeks now, and we had a sustained increase since about 5 weeks ago, but that last week showing a significant decline in the number of recorded cases nationally, as I just mentioned. Looking further back, we had experienced a Delta-driven third wave that just started about a year ago, so back in May 2021, that showed a sustained increase across the country, and then we saw towards the end of last year the Omicron-driven fourth wave over our summer months. So it's a fairly regular pattern that we're seeing nationally.
In fact, while we keep that
provincial.
Before we go to the provinces, Dr. Suliman, while we keep that there, I want to bring up a point while we still have it graphically represented. The months between September and beginning of December last year really represent one of the lowest points, I imagine, since we started tracking these figures when COVID-19 first came into South Africa. And then you track the peak of the Omicron-driven infections that's around December, beginning of this year, and then it starts to come down. Are you noticing any trend in terms of how this fifth wave is starting to come down? Is it as sharp a decline and as rapid a decline as previous waves, or does it look like it's going to be elongated in terms of how long it takes to come down to the very, the bottom of that wave?
Yes, so it's not quite as sharp a decline, and also not quite as sharp as an incline that we saw during the Omicron wave. If you look at those bars towards December and January, we're certainly not having quite as severe a wave as we experienced over the summer months. That being said, I think testing has reduced significantly. The decline that we have seen over the past week has been quite steady, and quite promisingly, it's not plateaued. It is a steady decline, over 20% week on week. So likely we'll continue to see that decline, and hopefully declining to a low baseline as we saw pre the Omicron BA1 wave.
Yeah, let's talk then a bit about hospitalizations and deaths that are as a result of, COVID-19 within this unofficial fifth wave. And you can tie that in with, there we're showing the numbers there for daily hospital admissions per week. And immediately after that, we'll then talk about the number of deaths we are seeing. But let's start with this one. What's the story that's emerging in as far as hospitalizations are concerned?
Yeah, so importantly, we have to recognize that while we're seeing many infections, we are seeing significantly or relatively fewer hospitalizations. So you can just look at the height of the bars on this particular graph, remaining much lower than we have experienced over previous waves. Hospitalizations have indeed increased, as you can see from the last few bars towards the right-hand side, but they are showing a decline. In fact, the last week, hospital admissions may likely have peaked nationally. We're still seeing about just over 2,600 new hospital admissions nationally last week, but currently that figure is reflecting a decline of 18% compared to the previous week. So we're also looking like hospital admissions nationally have also peaked, which is quite promisingly. And the other thing to point out is how much lower the number of hospital admissions have been in this surge compared to what we have experienced before. So a much lower burden on the healthcare system.
Yeah.
And I think that ties in with the fact that we have high levels of population immunity in the country. And that high levels of immunity are resulting in lower hospitalizations and also significantly fewer deaths. So if you look at the number of deaths being reported, it's significantly lower than what we experienced during the previous waves. Nationally, we're currently averaging just about 27 reported deaths per day. And that's about a tenth of what we saw during the peak of the first Omicron wave in the summer, which is also significantly lower than what we experienced in previous waves.
Yeah. Tell me about the picture between the different provinces. We make a point of highlighting how, and sadly we have to use the language that says Gauteng leads in infections, and the other provinces that do come up from time to time, you hear provinces like the Western Cape and KwaZulu-Natal, and in the last few days I've been seeing the Free State as well featuring there.
Correct. We also have to look at what's happening provincially, because it's not exactly the same trend that's occurring at the same time. In this fifth wave, we saw an increase in infections starting in Gauteng and KwaZulu-Natal, driven by the emergence of that BA4 and BA5 subvariants of the Omicron variant. And those two provinces really drove what we saw nationally, and they too have been the first to peak and are declining quite nicely at the moment. All of the other provinces then followed the trends that we saw in Gauteng and KwaZulu-Natal. But promisingly too, what we're seeing over the last few days or the last week is that 8 of the 9 provinces, so that's all 8 excluding Northern Cape, have passed a peak of infections. So it looks like the same trend is occurring across the provinces. They all peaked at a significantly lower level than what they experienced in the previous wave. And all indications are that it's likely that trend will now continue downward.
And this question, Dr. Suliman, I don't know how closely you track this. While we talk about having gone past the peak of the unofficial fifth wave, I wonder what the picture is looking like in as far as whether there's a wave or a ripple in as far as vaccination figures are concerned at this point? Do you track that at all?
I do, not quite as closely as the other epidemiological indicators. Vaccination numbers have continued, but at a relatively lower level compared to what we saw previously. We're currently averaging just over 44,000 vaccination doses administered per day, and that we've reached at least about 49% of the adult population receiving at least one dose, and about 31% of the total population considered fully vaccinated. I think the vaccination rollout has continued, but has significantly slowed, and likely as many people who wanted to get vaccinated have now received their vaccination dose. I think at the same time we need to also factor in that, as indicated, as a country we have high levels of population immunity, also due to many people being previously infected. So a combination of both natural and acquired immunity through vaccination.
Lastly, Dr. Suliman, a question I asked of the NICD's Professor Adrian Puren yesterday. Does this gathering of data and dissemination that happens on a daily basis, these trends that the NICD tracks and that you track, does it continue to be important in terms of how we respond to the COVID-19 situation in the country and how ordinary people understand it, or is it now largely for data enthusiasts such as yourself?
Well, I still believe that it's important to track these numbers. Look, we do keep track of other health measures too. Perhaps it's not as necessary to be so widely in the public domain as it has been for the past 2 years, but it's still important to understand how the virus is evolving. It will continue to mutate. We need to understand how new variants may play out in the population. And so tracking all these indicators still remains quite crucial in our understanding of how the virus is evolving and how it's impacting the population. I don't think we likely need to have those in the public domain shared on a daily basis. But I think in terms of policy and understanding the health implications, certainly, no doubt, we do need to continue.
All right, Avkura, thank you for your time and your insights. That's Dr. Ridhwaan Suliman from the CSIR, where he is Senior Researcher.